Hello, welcome back. Today for Back to School Basics, I want to talk about rheumatoid arthritis. So rheumatoid arthritis is an inflammatory joint arthritis that can involve any age in adulthood. So meaning after puberty, essentially, and into our 20s, 30s, 40s, and then can even present later on after menopause for women and at any point for men. So when we think about arthritis, there's a big misconception, a big myth per se, that arthritis is a disease that older people get, or it's a disease of aging joints, and that just isn't true. Young people, specifically people in college, can also develop rheumatoid arthritis or inflammation of the joints, particularly involving the smaller joints of the hands and the wrists. Sometimes rheumatoid arthritis can present as swelling of a knuckle that you may feel like it's tight or difficult to grip. Some people may have trouble typing or writing or twisting or turning things like a bottle top or even as simple as a door handle. So if you notice that you're waking up feeling more stiff in your joints, in your hands and your wrists, even your feet, then that can be something that progresses to more inflammation and potentially rheumatoid arthritis. Waking up feeling kind of achy and creaky is sometimes normal, but if that achiness persists for longer than 30 minutes or approaching an hour or more, then that's something that warrants being evaluated by a rheumatologist. So people like myself will evaluate you and do blood work to determine if you have inflammation that we can measure on a blood test, or something called the rheumatoid factor or anti-CCP antibody. Those can be helpful in defining rheumatoid arthritis. You may also have a different type of joint inflammation that we can assess over an exam by taking a look at your joints that are bothersome and then also assessing your blood tests. X-rays are often helpful as well if we see that there's a lot of changes, or if we're not quite sure what we see on exam and we're looking for very subtle changes that we can pick up on imaging. So to highlight, rheumatoid arthritis is not just a condition that happens as we age. It can happen at any point, particularly after puberty, during pregnancy can even present, after pregnancy for women, or at any point for young men as well. So if you're somebody who is starting to struggle with things like typing or writing, or you notice that you're just having a harder time being able to do normal things that you would otherwise find pretty doable, like exercising at the gym becomes much more of a difficult task for you, gripping hand weights or holding onto a bar, for example, then that's something that would warrant seeing a rheumatologist. So if you're looking for a rheumatologist who treats patients of all ages, adults, 18 and older, throughout all phases of their arthritis journey or autoimmune journey, Summit Rheumatology is accepting new patients as early as next week. Give us a call, 480-494-2770, or you can find us at info@summitrheumatology.com or summitrheumatology.com. Thank you, and we'll see you next time for another highlight of back to school basics, things that college age students may find that they need a rheumatologist to help evaluate. Have a good one.